Hello, my name is Christine Rubin, and today I'll be performing a remediation for my skills video on a central line dressing change using sterile technique. First, I'd like to point out that I am in school uniform. I have my badge, no jewelry, and no nail polish. Next, I'll provide patient privacy using two patient identifiers. I'll identify my patient. I will introduce myself, explain the procedure to the patient, and obtain consent. And next, I will make sure I have all of my necessary supplies and ensure that they're in the room. Hand hygiene, and place my mask on. For this procedure, it's great to ask the patient to wear a mask as well, to prevent any coughing or breathing bacteria onto the central line. However, if they prefer, they can just turn away while we're doing the central line dressing change. And then I'll place my clean gloves. Okay, so next I'm going to remove the dressing. I need to stabilize with my non-dominant hand, so I'm holding onto the catheter to stabilize. And we're going to use gentle lifting motion in a perpendicular motion away from the skin, starting from one corner and carefully removing the old dressing. And now that I have removed the dressing, we'll toss it in the garbage and then we will inspect the catheter, we will inspect the insertion site, and we will inspect the area of skin around the insertion site, looking for any signs of redness or infection. And it looks good to me, so there's no signs of redness or infection. And now we can remove our gloves and hand hygiene. So I'm going to start with the central line dressing kit, opening it away from me and removing the sterile field. Okay, and I'll take out my sterile gloves. And we're going to ensure that we are not touching the outside of the glove. So what I'm doing differently here is I'm only going to be touching the inner cuff, like so, and placing it over my dominant hand. Okay, and then I'm taking my sterile hand, placing my sterile hand under the cuff of the other glove. And then I'm going to place this onto my non-dominant hand. And now I will make sure I don't reach for anything below the waistline. I'm going to start with the chlorhexidine. And we're going to scrub for 30 seconds on all four sides. Back and forth motion, all four sides for 30 seconds. And then once over the top, grab the forceps, lift the catheter, and once on the bottom. Toss and let dry for 30 seconds. Okay, I'm going to start with the dressing, and I only have the smaller ones now because they are not reusable. So please bear with me. Toss into the garbage. Now we'll want to cover the central line completely, pressing down on all 4 sides. All right. Next, we'll remove the outer white portion. And then I will write the date and the time and my initials. And place it to the side, not blocking any of the visible central line. That way we can tell when it was last changed. And then I will clean my area. I will remove my gloves, hand hygiene, and document my procedure that I've completed it. So thank you very much for watching, and I appreciate your time.